what is bias? So in this video, I'm going to explain about what a bias is in respect to cancer treatments in particular. So a bias is a tendency for us to think in a certain way that is not necessarily correct. Humans, unfortunately, suffer from many biases. And there are biases that we're all familiar with, like racism and sexism. And an example of that may be that a clinical practitioner may treat you in a certain way based on your race or gender or whatever, but also that as a patient you may believe or disbelieve what a clinical practitioner tells you based on their gender or race or something else. Age bias is a big thing as well. So there are those kind of biases. So I guess you might call them prejudices. And some prejudices are useful. And the one I'm actually thinking of is age prejudice or age bias is very useful as a patient, but it's a very tricky thing because often, a younger doctor, for example, is going to be less experienced than an older doctor, and you may not believe what they say because they're young. Cancer skews towards older patients, obviously. So if you are in your advanced years, it may be quite common for you to be treated by doctors who seem much younger than you, and it may be quite difficult for you to take seriously what they say. And also they could be wrong because they may be inexperienced. So I guess in that case, prejudice could be very helpful. By the same token, certain older doctors, maybe their knowledge is out of date. Maybe they're set in their ways. But there are other biases which I think you call cognitive biases, which are like biases about how we think as humans. And three really important ones for cancer patients are confirmation bias, availability bias, and survivor bias. And I've got videos on all these three, and I hope you watch them because probably more than any of my other videos, those three have the potential to save your life. It is staggering and depressing when you learn about just how many biases humans are affected by. But we can do a lot about this on a practical level. Being aware of the bias can help making decisions. You could be aware that you may be biased. You may be biased towards a certain treatment because of something you've heard. And if you are aware of this, that you're biased, then you might kind of think, hang on, I'm going to go and get a second, third, and fourth opinion. Or you may notice that your oncologist is biased towards chemotherapy because that's what they know most about. And they may be trying to put you off different treatments that they're not very familiar with. So I strongly recommend you watch those three other videos. What is confirmation bias? What is survival bias? And what is availability bias? Because they could save your life.